This is a general explanation of general anesthesia. Please note that there may be some differences depending on the type of surgery and your overall health condition. Please adjust the playback speed to make it easier to understand. Once your surgery is scheduled, please follow the given instructions and take care of your health. If you catch a cold, it is safer to postpone the surgery for a few weeks. If you experience any health issues, please contact us. You can eat dinner as usual the day before surgery. However, after that, you will not be able to eat until the surgery is completed. Please avoid snacks and other foods as well. Regarding fluids, in some cases, drinking water may be allowed under specific conditions. Usually, you will be given instructions when you are admitted to hospital. However, if you have not received any instructions, please confirm with your medical provider. On the day of the surgery, you will be guided to the operating room. You may walk, use a wheelchair, or be transported on a stretcher, depending on the circumstances. Once you arrive, you will lie on the operating table. Preparation will then begin, including attaching an electrocardiogram, a blood pressure monitor, and an oxygen monitor. If you do not have an intravenous line already, one will be inserted at this stage. Once the preparation is complete, an oxygen mask will be placed on your face. The mask usually delivers only oxygen. When the anesthesiologist tells you that you will soon fall asleep, an anesthetic will be administered through your intravenous line, and you will gradually lose consciousness. At this point, you may feel a slight tingling sensation in your intravenous line, or you may cough, but this is due to the medication and is not a cause for concern. From this moment on, you will not be aware of anything. Once you are asleep, the anesthesiologist will use a metal instrument called a laryngoscope to insert a breathing tube into your throat. This tube will be connected to a ventilator to support your breathing during surgery. During this procedure, the laryngoscope may accidentally hit your teeth, which could result in chipping or breaking a tooth, or injuring your lips. However, protective mouthpieces can help reduce this risk. Additionally, depending on the surgery, a nasogastric tube may be inserted through your nose, which can sometimes cause nasal bleeding. Although rare, general anesthesia carries risks such as malignant hyperthermia, anaphylactic shock, and pulmonary embolism. In addition to these rare complications, pre-existing medical conditions may increase the risk of severe drops in blood pressure or respiratory dysfunction. That being said, the overall risk of death from general anesthesia is estimated to be 1 in 250,000. However, this risk is lower for individuals in good health and higher for those with pre-existing medical conditions. To manage these complications, medications, medical devices, and consultation with specialists may be used. If there is significant blood loss during surgery, a blood transfusion may be necessary. Additionally, if a patient's condition is deemed unstable after surgery, they may be transferred to the intensive care unit ICU instead of returning to a regular hospital room. In any case where emergency measures are required, all necessary steps will be taken to ensure the patient's safety and prevent complications. After the surgery is completed, the breathing tube is usually removed while you are still in the operating room. You will then be transferred back to your hospital room once you have recovered to a certain extent from anesthesia. Due to the breathing tube, you may experience a sore throat, discomfort, or hoarseness. These symptoms usually improve within a few days, but in rare cases, otolaryngologist may need to be consulted. Additionally, you may notice temporary marks left by medical tape. If you experience pain in your throat or at the surgical site, nausea, chills, or numbness after returning to your hospital room, please inform the medical staff. They will provide appropriate care based on your symptoms. Even after surgery, there is a risk of complications such as aspiration pneumonia or prolonged numbness in localized areas. Follow your doctor's instructions and engage in rehabilitation within safe limits. This concludes the explanation. Thank you for your attention.